Hello, welcome back to my channel. For today's video, we are going to do the practice questions and answers for the malignant breast tumors. This is for the Mammography Registry review. So we'll get into the type of breast cancers, what age group goes for this, goes for that, how it can be identified on the mammogram, and how a patient will feel these symptoms. So I want to give a special shout out to Miss Doreen. She is the one who has been looking at all of my other mammo videos, especially the Q&A, and she has been requesting, or she had requested this video. She wanted me to do or make another malignant pathology video. I do have a video where I made about the benign tumors. I have a video where I did put this one in there, like some of the malignant questions, but you just have to check out the full playlist. But anyway, I made this video because she requested it. So now we'll get into the Q&A part. What I like to do is I like to read the question. If you're new to my channel, I like to read the question, read the answer choices, and then I'll give you the answer with the explanation. A lot of people find this helpful whenever they hear it being read out because some people is at work, some people is cleaning up, so they're able to hear me while they're either looking at their computer or phone or doing other things. So I'll give you just a moment to think of the answer and then I'll tell you the answer. So here we go. For question one, a spiculated breast lesion is an indication for, is it a benign tumor, dense breast tissue, macrocalcifications, or malignancy? Okay, the correct answer is malignancy. A spiculated lesion have a solid tumor that has an ill-defined border. Most breast cancers have a spiculated lesion. A benign lesion or macrocalcifications would not have a spiculated lesion border or characteristics. And if I'm going too fast, you can always rewind the video or pause it. For question two, which breast cancer is the most common type and account for 90% of all breast cancer types? Is it ductal carcinoma, lobular carcinoma, papillary carcinoma, or tubular carcinoma? Okay, just a few more seconds. Okay, the correct answer is ductal carcinoma. Ductal carcinoma is the most common breast cancer that is accounting for about 90% of the breast cancer cases. It's also known as DCIS. So DCIS is a type of breast cancer that is confined to the ducts. This type of cancer does not invade the duct walls. Lobular carcinoma accounts for 5% to 10% of all breast cancer cases. Papillary carcinomas account for 0.9% of all breast cancers. Tubular carcinoma accounts for 1% to 2% of all breast cancer types. For question three, which breast tumor has an appearance that is large and similar to a fibroadenoma? Is it ductal carcinoma, Paget's disease, Phyllodes, or sarcomas? I'll give you a few seconds or a few moments to think about this one. Okay, the correct answer is phyllodes. So phyllodes tumors are rare and it has a similar appearance of a large fibroadenoma. These tumors are firm, mobile, and well circumscribed. They can increase in size at a very fast and rapid rate within weeks. Ductal carcinoma is the most common breast cancer that is accounting for about 90% of the breast cancer cases. DCIS, which is also known as ductal carcinoma, remember, is a type of breast cancer that is confined to the ducts. This type of cancer does not invade the duct walls, so that's for DCIS. For Paget's disease, this is a special form of ductal carcinoma that has changes to the nipple that is very similar to eczema. So I have eczema, so whenever I get it all over my body, still checking my breast for different changes. But if I'm getting in that area, of course, it does make me nervous being a mammotech. But before I was a mammotech, I probably would just think, oh, it's just eczema, just going other places like it always do. If you have eczema, could you put in the comment box that you know what I'm talking about? That once you get it on your neck, it's going to spread bigger. It's going to go in your arm, legs, behind your knees, in the creases of everything. So that's for eczema, but Paget's disease, it gives that eczema-like nipple changes whenever it comes to like a rash or scaliness. Sarcomas are rare and it arises from the mesenchymal connective tissue, such as your fat, nerves, muscles, blood vessels, bone, or cartilage. Question 4. Which breast cancer accounts for 1% to 2% of all breast cancers and is often non-palpable, meaning the patient cannot feel it, such as it's not a felt lump. That's what non-palpable means. Ductal carcinoma, is it lobular carcinoma, papillary carcinoma, or tubular carcinoma? Hey, I'm about to give the answer in a few seconds. Okay, the correct answer is tubular carcinoma. This is a form of invasive ductal carcinoma, or IDC, and accounts for 1% to 2% of all breast cancer types. This type of cancer is non-palpable and is very similar to a benign radial scar. Your ductal carcinoma is the most common breast cancer that is accounting for about 90% of the breast cancer cases. BCIS is a type of breast cancer that is confined to the ducts. This type of cancer does not invade the duct walls. Lobular carcinoma accounts for 5% to 10% of all breast cancer cases. Papillary carcinomas account for 0.9% of all breast cancers. So I'm giving you the explanation so that you can see what is the correct answer, why it is the correct answer versus why it's the answer, why is the other answer choice is not the correct one. So not only should you read the questions, the answers, and the explanations, I wouldn't just focus on the answers. I was focused on what the explanation is stating as well, because I'm giving you a lot more information as far as what the question and the answer is about versus you just reading the answer and moving on. So just want to throw that out because whenever I was studying for my registries, I studied the lessons first. So I have lessons on my page that's an hour long. It's very helpful. And then I studied the questions and answers, but I always made sure that I studied the lesson. So I have people who've told me that they've, just studied the answers or anyway, you just need to just make sure that you study everything pretty much. Question 5. Which breast cancer accounts for less than 2% of all breast cancers and may be associated with ductal carcinoma in situ, or DCIS? Is it lobular carcinoma, mucinous cancers, papillary carcinoma, or tubular carcinoma? Just give me a few moments because these questions may start getting like a little trickier. Okay, the correct answer is mucinous cancers. Mucinous or choroid cancers, whichever one you see, if asked, accounts for less than 2% of all breast cancers. So mucinous is the same thing, or it may be referred to as choroid cancers. So this type of breast cancer may be associated with ductal carcinoma in situ, or DCIS, that occurs with or without microcalcifications. Lobular carcinoma accounts for 5% to 10% of all breast cancer cases. Papillary carcinomas account for 0.9% of all breast cancers. Tubular carcinoma is a form of invasive ductal carcinoma, or IDC, and it accounts for 1% to 2% of all breast cancer types. So now you look at how the question is asked what percentage. You see how other cancers have a different percentage, so you can also make sure that you know your percentages as well. All right, so I have a lot of people watching from all over the place. I have not found anyone who is watching from another country. Um, you can all pass the word if you have anyone that is in another country that they can use this registry review playlist that I have of all my questions, of all my videos that's not questions, like my lessons. They can use this to prepare for their registry. This isn't just for ARRT. Although I'm following the ARRT content specifications and guidelines, anyone can study or use this material. So I have some people, I'm starting from where it say leave me a comment. Just something fun that I like to do if you're watching. And if you haven't commented, you can say I'm watching from, and then you can put your state, because the state that I used to live in, Louisiana, we did not have hardly any mammo positions available when I left there. That was years ago. I'm sure there has been a lot of changes, but when I was looking to see if this is something I should get into, or what else I can get into other than x-ray, it was probably 3 jobs in the whole state available. So it's very interesting to see where everyone is watching from and if they have plenty of jobs available or not. So starting from where it say leave a comment, it's on my left hand side, but I'm sure it's on your right hand side if you're looking at me. So Elizabeth is watching from Houston. Then I have Rich Girl Naya watching from Atlanta, Georgia. You have Cherie. Miss Cherie is watching from Maryland. Veronica is watching from California. And you have Miss Doreen at the very top. She's watching from Florida. Her name is right beside the green words. And then you have Argelia. Sorry if I'm mispronouncing your name. The print is a little bit small above me, how I have it, so just it can fit in this part of the video. Is watching from Arizona. So thank you all for commenting. I'm sure all of your states have plenty of jobs available. I can't speak for Arizona because I haven't been, or Maryland, because I haven't heard a lot of people move to or from those states, but I know from California, there's a lot of people moving from California or moving to California. Also, the same thing for Florida. I've been watching like a lot of YouTube videos where a lady who is trying to, and this isn't related to radiology, this is blogs or whatever. She's trying to move from her current state to move to Florida, but to get another job. So anyway, I'm sure all of these states have a lot of jobs, have a lot of things to offer. Thank you all for commenting. I will get back to the video now. Okay, question 6. Which breast carcinoma accounts for 0.9% of all breast cancers and can occur in older postmenopausal women? Is it lobular carcinoma, medullary carcinomas, papillary carcinoma, or tubular carcinoma? I'll give you just a few moments to think about this because this is probably where the questions start getting a little difficult and require more thinking. Okay, the correct answer is papillary carcinoma. Papillary carcinomas account for 0.9% of all breast cancers. This is a rare form of breast cancer which is characterized by finger-like projections that is growing from the ducts of the breast. It is often found in older postmenopausal women. You see how I have that highlighted and capitalized, and it looks like a circumscribed cystic mass. Medullary carcinomas accounts for 5% to 7% of all breast cancers. Lobular carcinoma accounts for 5% to 10% of all breast cancer cases. Tubular carcinoma is a form of invasive ductal carcinoma, IDC, and accounts for 1% to 2% of all breast cancer types. Okay, question 7. Which breast carcinoma accounts for 5% to 7% of all breast cancer and have a good prognosis? Is it lobular carcinoma, lymphoma, medullary carcinoma, papillary carcinoma? Just a few moments. Okay, the correct answer is medullary carcinomas. Medullary carcinomas accounts for 5% to 7% of all breast cancers. This type of cancer has a good prognosis or outcome and often occur in younger women. Lobular carcinoma accounts for 5% to 10% of all breast cancer cases. Lymphomas accounts for 0.1% to 0.5% of all breast cancers and is extremely rare. Papillary carcinomas account for 0.9% of all breast cancers. This is also a rare form of breast cancer, which is characterized by finger-like projections that is growing from the ducts of the breast. So as you can see, the explanations are important. It gives you a lot of information. So here is how your different margins look on mammogram. If you have, and also on ultrasound as well, breast ultrasound. If you've seen my anatomy review video, that's the long video, that's an hour. And of course, you don't have to watch those hour-long presentations in one sitting. You can watch it for however many minutes and then pause your video and come back. YouTube, for most of the videos that I've watched for any other, person channel, especially if I watch like a lot of live videos for like entertainment purposes, you can pause the video or even close out and pick up where you left off at. So hopefully that helps because those videos, it give like a lot of information. I worked for a long time on those videos just to make it very informative, make it thorough for everyone. So if you want to check out those videos, I have this mentioned in there. But for your circumscribe, these are going to be your benign tumors. So most benign tumors will have their circumscribed margin like this. For your obscured, it's hard to see the breast cancer whenever the margin is obscured. So it can, raise some type of level of suspicion whenever you have these margins. Uh, Microlobulated, indistinct, spiculated. This is probably whenever, especially for indistinct and spiculated, those biopsies going to be recommended and possibly ordered for the patient to just make sure this is not any type of breast cancers. For your spiculated margins, that is a sign of malignancy. So as you can see how the mammogram picture on, it would be my right. So it's on my right, right above me. So um, you can see how this image, it looks exactly or very similar to the margins in this other picture. So you can study the margins, make sure that you know how it's looking. Of course, whenever you see it on actual mammogram. A patient, some patient can sense when something is wrong or they feel nervous about something. Never tell them their results. Never tell them if you see something bad or not, because they will ask you. I've, at some point in your career, I know for a fact, they're going to ask you, what did you see? Does it look good? Does it look bad? I always say, you can make a joke about it. You don't have to always be serious, at work, because people is already nervous, so they like when you come in and you're laughing and joking with them, you're uplifting them. Throw out a joke. Oh, I'm just a photographer. I'm just the camera woman, or I'm just taking your picture. I'm going to send it to the radiologist. They are the ones who are going to read it. When I work in MRI, I have texts all the time tell patients, oh, I'm not the one who make the big bucks. I'm sending it to the one who make the big bucks. So sometimes you don't always have to be serious. You can make something like, it's like if they have a breast cancer, of course you want to not be joking, but if it's like a day where you're working in screening mammogram, if just sometimes just have conversations in between, like small talk, have small talk. So I always tell patients, you have a breast. That's all I can tell you. You have a breast. I don't tell them if their breast tissue look dense. I don't tell them if an area looks suspicious. They may say, what is that? I don't tell them. The only thing I tell them is you have a breast. So hopefully that makes sense. So now back to the questions. Okay, for question 8, which breast carcinoma is a precancerous lesion that has abnormal cells and is found incidentally during a biopsy? Is it ductal carcinoma in situ, or DCIS, lobular carcinoma in situ, or LCIS, medullary carcinomas, papillary carcinomas? Okay, I'm about to give you the answer. And if you remember, like a lot of explanation answer choices that I gave you in the previous videos, it should be easy for you to, or not really easy, it should be like a little easier for you to eliminate some of the answer choices. That's why I kept throwing out those situations in the explanations. The correct answer is lobular carcinoma. Lobular carcinoma in situ, or LCIS, is a precancerous lesion that has abnormal cells that has not penetrated through the lobular walls. It is not considered a cancer. Ductal carcinoma in situ, or DCIS, is a type of breast cancer that is confined to the ducts. Medullary carcinomas accounts for 5% to 7% of all breast cancers. This type of cancer has a good prognosis, meaning outcome, and occur often in younger women. Papillary carcinomas account for 0.9% of all breast cancers. This is a rare form of breast cancer which is characterized by finger-like projections that is growing from the ducts of the breast. Okay, for question 9, which breast carcinoma accounts for 10% of all breast cancers and is difficult to recognize mammographically? Is it ductal carcinoma in situ, or DCIS, invasive lobular carcinoma, or ILC, lobular carcinoma in situ, or LCIS, or medullary carcinomas? So I'll give you a few moments to think about it, since these are probably starting to get a little bit more difficult, or not really difficult, but requires more thinking. All right. The correct answer is invasive lobular carcinoma, or ILC. So invasive lobular carcinoma, ILC, accounts for only 10% of all breast cancers. This type of breast cancer accounts for a large percentage of malpractice cases because it's due to a failure to detect this type of breast cancer. So, with this type of breast cancer, there are a lot of um, patients that are suing the doctor or the radiologist who was not able to properly diagnose their condition for having this. It is difficult to detect by the mammogram images or machine. Therefore, ultrasound and MRI may be better, much better at detecting this type of breast cancer. Ductal carcinoma in situ, or DCIS, is a type of breast cancer that is confined to the ducts. Lobular carcinoma in situ, LCIS, is a precancerous lesion that has abnormal cells that has not penetrated through the lobular walls. It is not considered a cancer. Medullary carcinomas accounts for 5% to 7% of all breast cancers. This type of cancer has a good prognosis and often occur in younger women. So this is the reason why the answer is correct, and this is the reason why the other answer choices is not the correct answer. For question 10, which breast cancer is a rare form of aggressive invasive cancer that accounts for 1% to 5% of all breast cancers? Is it inflammatory breast cancer, lymphoma cancer, mucinous cancer, or sarcomas cancer? Just giving you just a few more moments. All right, the correct answer is inflammatory breast cancer. Inflammatory breast cancer, or IBC, accounts for 1% to 5% of all breast cancers. This rare form of breast cancer is aggressive and invasive. Patients do not have a mass or a lump that can be felt with this type of breast cancer, which makes it difficult to find on the mammogram images. Lymphomas account for 0.1% to 0.5% of all breast cancers and is extremely rare. Mucinous or choroid cancers account for less than 2% of all breast cancers. Sarcomas are rare and arises from the mesenchymal connective tissue, such as your fat, nerves, muscles, blood vessels, bone, or cartilage. All right, so that's it for this video. Thank you all for watching. If you found this video to be helpful and you enjoy watching these videos that I make, please give the video a thumbs up or leave a comment. Whenever I see that you all gave the video a thumbs up or commented, I really appreciate it because although I'm not complaining because I love making these videos, I will keep making registry review videos for X-ray, CT, MRI, mammography, and then I start on breast ultrasound. But it is time consuming. I may make it look easy because I'm throwing these videos out because I'm working fast, but it is time consuming. So whenever I see a thumbs up or a comment, I'm like, oh, it helped someone, you know, they learned something from it. And I'm just appreciative when I see your thumbs up or your comments because I do other things. I'm in school for a degree, a higher degree in radiology, and then I work. So I try to get these videos out when I have like downtime. So, um, anyway, thank you all for watching. I want to give a shout out because these ladies use my videos and pass their registry. So, if you've been watching all of my registries, I know you hear me say this all the time, but there are people. Um, who have not came across some of these videos. So they're watching it for the first time, even though you hear me say this all the time because you're going through my playlist, you're being supportive. There are people who is watching these for the first time. So they're probably looking like, why does she have those pictures up there? So I always just try to say things over so that they can understand. But these ladies use my playlist. They passed the registry on the first try. One of them passed their registry in May of 2025, I believe. Another one passed theirs in June of 2025, I believe. So they came back to the video or one of the videos of my mammo videos and told me, hey, thank you, I passed. So if you don't mind, if you've been using my videos, when you pass, could you come back under one of the mammo videos, say that you passed, and I will add you to the shout out board. So this is my shout out board. But other than that, thank you all for watching. I would assume that these ladies probably mainly studied those videos that I have for an hour long. Whenever they took their registry, there was like, I didn't even have half of these mammo videos up. I started making the Q&A videos. They probably caught maybe one or two, who knows, maybe three Q&A videos. I think I have probably six, seven, or eight now. So they didn't have half of what you all that's watching now have, and they still passed my registry. So I'm just going to assume that they also focus on those 1 hour videos that I made that will be equivalent to you paying hundreds of dollars for a seminar. But I made it and making it to where it's free for everyone. So anyway, thank you all for watching. Please share with anyone that you know who is taking their registry soon. But anyway, thank you all for watching. I will see you all in the next video. And bye. Good luck.